And so even for me, who was someone who always kind of was like that, I still kind of a little bit was like this mindset where I was hyper focused on the problem, not realizing how much every body system, how much they each connect with each other and how much they each influence each other. And obviously the brain, the neurons that go everywhere in the body, right? So there's so much connection between, our minds and our bodies. And, for an example, which I'll give is a pretty common one that I see is back pain, right? Where you're just like hyper focusing on the back. And in acute cases, that's typically what you should do. You hurt your back, and but when the problem becomes chronic, and when the imaging shows nothing remarkable, and in the back I'll even say disc degeneration or disc bulging, there's really no correlation with chronic pain and those symptoms, to just take a step back and look at what else is going on and try and make those connections.
Yeah, take a step back, create some space, have some presence, and recognize what's in front of us. If you could, people who are working in that traditional healthcare setting where they're constantly busy, moving, doing all the different documentation requirements and those sorts of things, what do you say to those folks in terms of, take a step back, but how do you weave that into their daily work? Is there a way to kind of be more mindful that you would recommend?
For my particular with the clients that I work with, so let's say you're having, if you work with people who have chronic pain or chronic symptoms such as like dizziness and vertigo is one that's not really pain, but it's a chronic condition, or chronic fatigue. I would say the best way that you can do that is to get curious. Sure. So I know you've got a lot going on, you've got a lot to chart, you've got other patients to see. Sometimes just asking a few curious questions will help you kind of make those connections with your patient about other things that are going on. And that's my suggestion for the providers who are maybe treating or seeing patients with chronic conditions where, you're rolling your eyes and thinking like, what can I possibly do for this patient in the next 20 minutes that I see them? Yeah. They've had back pain for 20 years. What can I do? Is to get curious and to ask them questions about their symptoms.